HER2 CLIMB is a randomized phase 3 trial, which has led to the FDA approval of Tucatinib to be given in combination with trastuzumab and capecitabine. This randomized phase 3 trial demonstrated a significant improvement in progression-free survival as well as overall survival when Tucatinib was added to capecitabine and trastuzumab in the second and third line setting for patients with metastatic HER2-positive breast cancer. Almost half of the patients who participated in this trial had brain metastases at the time of study entry. And very remarkably, those patients with CNS disease fared just as well as those patients who didn't have brain metastases in terms of progression-free survival and overall survival, which is really remarkable as those patients who have CNS disease generally have a poorer prognosis. So Tucatinib's a very important addition to our armamentarium for treating those patients with HER2-positive metastatic disease, particularly those with brain metastases. It's got a very favorable safety and toxicity profile and is actually better than some of the other oral tyrosine kinase inhibitors that are out there that are used currently in conjunction with capecitabine for the management of patients with HER2-positive metastatic breast cancer to the CNS. So because Tucatinib doesn't target EGFR to the same degree as some of the other tyrosine kinase inhibitors, it actually isn't as associated with diarrhea and rash as some other agents and is actually very well tolerated. In the pivotal phase 3 trial, the HER2 CLIMB trial that led to the approval, there were very few patients who had to discontinue treatment because of toxicities, and the vast majority of the toxicities or diarrhea and LFT elevations were generally of low grade and easily managed. So I think Tucatinib, capecitabine, trastuzumab is a very important regimen we use for patients with brain mets or even those that is very well tolerated, associated with a good quality of life and an improvement not only in progression-free survival, but overall survival as well. Excellent. We are continuing to add to our armamentarium of drugs and regimens that we have available for patients with HER2-positive metastatic disease. Ultimately, patients do progress, and so there's certainly a need to continue to develop new therapies to help those patients who have HER2-positive metastatic disease live longer and better. Tucatinib is a very important addition, particularly for those with CNS metastatic disease, but eventually these patients will progress and newer strategies will be needed in the future.